في عندنا renal replacement therapy. renal replacement therapy هذا اللي راح اخذهن. عندنا chronic kidney education. Chronic kidney education. It is so important to educate patients with chronic kidney disease about the step before entering the end-stage kidney disease. في شيء اسمه renal replacement therapy and quality of life. Like if diabetology following diabetes patient or urology following the patient with kidney stones and notice that GFR is less than 30, should refer the patient to nephrologists. فإذا كان ال GFR less than 30, less than it, indication about type of renal replacement therapy إن فيه hemodialysis و peritoneal dialysis. اللي هو hemodialysis اللي هو vascular access، يصير فيه vascular access. And peritoneal dialysis is quality of life advantage. The patient does not need to go to center. Everything can be done at home. He or she can travel. These are advantage of peritoneal dialysis. إن فيها quality of life. في kidney transplantation refer when the GFR less than 20. إذا كان less than 20 or living kidney transplant with family friends, build time on a list before dialysis initiation. Even transplant before dialysis initiation, preemptive, it can be done before starting the dialysis. end-stage renal disease. إذا كان في end-stage renal disease patient had a renal disease في impairment progression of kidney function GFR less than 15, so we have to compensate the kidney function. If the patient refuse all the 3 options, especially in old age patient, we give them symptomatic treatment till they die. Oh my god. This option is available in European country and American country. They have this option. يعني إذا البيشنت ما يبي peritoneal dialysis ولا kidney transplant أو hemodialysis اللي فسوي comfort care, we give him symptomatic until they die. And kidney transplants, the treatment may start with hemodialysis or peritoneal dialysis, then kidney transplant or direct to kidney transplant. في end stage renal disease treatment نقدر نسوي له kidney transplant directly. يعني يقدر البيشنت يبدأ مع الهيمودايليسيس، إذا ما ضبط وياه يقدر يحول إلى peritoneal dialysis and vice versa. Also, if the patient gets a kidney transplant and then it fails again, patient can shift to the doing any type of dialysis. So that's what interchangeable mean. Option compensates kidney function to option dialysis and hemodialysis and peritoneal dialysis and renal transplantation. The patient refuses all previous options, so we go to the comfort care by giving the patient symptomatic treatment till the patient dies. Dialysis option. The doctor just again hemodialysis and center for 3 weeks and home, short daily, non-continental. Peritoneal dialysis, CABD and CCBD. شنو ذيلي at home. Indication of dialysis: severe manifestation of kidney dysfunction. يصير uremic symptoms، يعني يصير في encephalopathy, coma, pericarditis, anorexia and nausea, impaired nutritional states, increased sleepiness, a decreased energy level, attendance and cognitive tasking. هذه because it can lead to more severe conditions such as constructive pericarditis or cardiac tamponade. An indication of dialysis شكلنا عنه اليورميك، إن في يورميك symptoms اللي شكلنا عنها encephalopathy, coma, pericarditis, anorexia and nausea, impaired nutritional state, increased sleeplessness and decreased energy level and cognitive tasking. One of the urgent indication for dialysis because delay in the condition may lead to constructive pericarditis. Pericarditis with normal kidney is not an indication for dialysis, which not improved after medication. As a result, the anorexia and nausea, the patient will lose weight, also because of toxins. Constructive pericarditis is a condition that the pericardium becomes stiffer and thicker than normal, lead to many complications such as heart failure. أما cardiac tamponade is a condition that the fluid build up in the space between the heart muscle and the outer covering sac اللي هي pericardium. يصير فيه fluid. هذا الماي في القلب. Because it can lead to more severe condition. Volume overload, not responding to diuretics. Patient with chronic kidney disease and renal impairment with volume overload and not responding to the diuretics may develop pulmonary edema. يعني هو ما يستجيب للدايرتكس وغير كذا يسوي pulmonary edema. hyperkalemia 6.5 not responding to medical treatment or if there is an ECG change. hyperkalemia acidosis is not responding to a medical treatment. high urea يصير 200 والكرياتينين فوق 10. فإذا كان الفوليوم overload بس ما في response حق الدايرتكس، في هايبركاليميا وفي أسيدوسيس، في هاي يوريا أو في يوريميك symptoms انسفالوباثيك وبريكاردايتس أنوركسيا nausea decrease energy level. هذا هو hemodialysis. Definition: it is the movement of solute and water from the patient's blood across the semi-permeable membrane, which is the dialyzer. Movement of solute and water from the patient's blood. dialyzer اللي يسوي dialysis. The bed and semi-permeable membrane between two compartments. One of them has a high concentration of particles, or other low concentration of particles. The particles from high concentration compartment will pass through membrane to low concentration compartment. This is diffusion. The blood is high concentration compartment. Dialysed fluid, this is the low concentration compartment. The membrane is called dialyzer. فالبلد يروح هنا يسوي diffusion. The principle of hemodialysis: blood from the patient is pumped through semi-permeable membrane, the dialyzer, often called artificial kidney, which will bring the blood into close contact with dialyzed fluid, flowing recurrent to the blood. Oh my god, مسكين حزني. The cycle of hemodialysis: in order for blood to leave the body, where there should be an excess blood vessel, there is a pump to draw the blood, pass through artificial membrane, artificial kidney or dialyzer. Dialysate enter the opposite for better diffusion inside in columns. Oh my god, حد حزن. وده يرجع يدخل للجسم ثاني. By diffusion, toxins and high concentration of practical go to the dialysis as a waste product. احتاج أشوف فيديو. Then the blood return to the patient. In memory of the event, at a time like this in the class and during heavy rain, the computer started to show smoke and the spread of smoke in the classroom atmosphere. Oh, سالفة غريبة. اوكي wait. والله صدق إني قاعدة أقرأ. دقيقة. اللي الحين فهمته إنه في يدخل من أنبوب بعدين يسوي filtration. أي أدري. يا عادي.
سوي شنو معي عادي.
تسوي waste product بعدين تدخل بعدين هنا تسوي الدياليسيس اللي هو الفلتريشن هنا يصير بعدين الويست يطلع والكلين يدخل هنا بعدين يجي ويطلع ويرجع له مرة ثانية هنا ويعطونا شيء ثاني وياه هيبارين بام. Principle of hemodialysis. The plasma biochemistry changed toward that diacylate owing to diffusion of molecule down their concentration gradient. The column filled with blood and others filled with dialysts. Between them, a filter or semi-permeable membrane. اوكي هذا في dialysed وبلاد بينهم فلتر اللي هو semi-permeable membrane. The toxins only present in blood will diffuse to here. Dialysed. Dialysate runs in the opposite direction of the blood for better diffusion. لو كان دم فلويد يمشي في نفس الاتجاه هيكون تركيزه تساوي الجزء الصفي ونحكي في diffusion. لكن لو كانوا متعكسين diffusion بيمشي فهنا يصير كذا ماشي وذا كذا ماشي كذا يعني. كل ما كبر كل ما قلت عملية diffusion. For membrane pores have a specific size. This practical should suit the pore size. كل ما كبر السطح كل ما كبر diffusion. Factor affecting diffusion: the concentration gradient, blood flow rate, the dialysis fluid flow rate, molecular size, smaller increased diffusion. إذا كان أكبر decreased diffusion. surface area وهكذا. فإذا كان كبير decrease diffusion وإذا كان صغير increase diffusion. صراحة يحزن حيل يا أخي حتى حزين أحس الموضوع. الحمد لله يعني قاعد أحس الحمد لله. This is how the dialysate looks like. Has four ports. The important thing that dialysate and the blood are contrary currents اللي هم عكس بعض هجي وهجي. هنا blood exits from here و blood enter من هنا فيدخل ويطلع من هنا. أما اليالسيت enter من هنا يجي من هنا ويطلع من هنا بعكس بعض. وهذا these small columns are where blood pass like veins surrounding with the fluid dialysed for diffusion. hemodialysis vascular access. As what we said, hemodialysis cycle, that is important to have access for blood to exit and enter circulation. This access might be catheter or fistula or graft. يعني catheter or fistula or graft. وش الكاثيتر وش الفستولا وش الجرافت؟ الجرافت انه يصير في جرافت انه تحط شيء، و double lumen catheter يعني زي هذا double lumen catheter في فتحتين. temporary catheter في الجيوغلر femoral subclavian، هذا في حالة اللي شو يسمونه emergency. انها تكون for month لين الفستولا mature. وش الفستولا هذا؟ pre-match jugular vein subclavian and femoral trans lumbar inferior vena cava bare mecath or permanent catheter تكون جزء من الcatheter subcutaneous to reduce infection possibility to get into blood. فتصير هي موجودة عشان نمنع infection. فيصير أول شي نحط double lumen catheter وبنسوي لنا permanent catheter. AV fistula. What is the fistula? Attached to artery and vein. Because any superficial vein is fragile and cannot tolerate the large bore of dialysis needle. So we do anastomosis between artery and vein. يعني يحط هذين. Then the vein near the artery undergoes musculatation and becomes stronger and more superficial to the skin. We will not insert a needle in the artery, both of needles and vein. We just anastomosis between artery and vein to make vein become more stronger and superficial to the skin. يعني ما راح ندخل في الارتري any needle، بس نبي نخلي ذا مرة قوي، بس ما أدري شلون يسووه هذا، ما فهمت. بعدين في graft. When a patient vein is friable and cannot tolerate the continuous needling. As a patient do dialysis 3 times per week, we use synthetic graft, which is produced from substance tolerate the multiple injection. We have to connect the artery and vein to it. Then I can use it for frequent needle. So synthetic graft, which is produced from substance إن تقدر تتحمل multiple injection، فيحطها. I have to connect the artery and vein to it, then I can use it for needle عشان ما يصير له أكثر من مرة يتعور. Which type of vascular access is associated with better outcomes in hemodialysis patients? Centrovenous catheter, arteriovenous graft أو arteriovenous fistula. Because it's natural thing, not like catheter and graft, which may cause thrombosis, obstruction and infection. Permanent, a low rate of infection and thrombosis and infection. فالفيستولا أحسن شيء، بس ما فهمت شنو يصير في الفيستولا بالضبط يعني. شنو أنستموسس هذا؟ يمكن في شي في الأنستموسس. يا أخي مو حلو، ما حبيت، حالي حزن. إذا شفته بعدين بسوي أنا؟ يعني إنه كلهم ناس طبيعية ما فيهم شي، وفيهم شي يعني، بس إنه مو اللي ما علينا. أوكي خلاص. في عندنا vascular access guidelines. أنا رحت شفت بحثت يعني كيف وش سالفة ده، فهمت يعني. A patient should know that he could take care of arm. Our vein shouldn't be used for canal, but dorsum of same hand could be used. Arm vein suitable for placement of vascular access should be perceived regardless of arm dominance. Arm veins, particularly the cephalic vein of the non-dominant arm, should not be used. Dorsum of the hand could be used for IV. A medic alert bracelet should be worn to inform hospital staff to avoid IV cannulation of essential vein, to avoid injury which may lead to failure of fistula. Yeah. Subclavian vein catheterization should be avoided for temporary access in all patients with chronic kidney disease. أن stenosis يؤدي إلى breakload and use of ipsilateral arm for vascular access. The stenosis and decrease blood flow and failure of a fistula. Frequency and duration. In Econ 3 times a week, each for 4 hours. Dry weight. إنه ما يصلح يكون الوزن زايد ولا ناقص، فلو زاد نعطي نقصة، لو قل عطيناه الناقص. Patient won't be able to urinate, so fluid will accumulate in the bodies. So we have to measure patient body weight before the dialysis and adjust the machine based on the increase. Make sure the patient is not complaining from edema, congestive vein, ascites resulting from overload, or hypotension and tachycardia which resulting from dilated أو إنه قال يعني عنده. You should maintain balance between overload and depletion. Ultrafiltration. This is the removal of water and solute under the hydrostatic pressure to remove excess weight above dry weight. And ultrafiltration. يعني يصير هو موجود هذا عشان نقلل الوزن حقه. anticoagulation نعطيه هيبارين for extracorporeal circulation to prevent thrombosis which may occur because of contact with the filter and plastic tubes which lead to stimulation to coagulant factor. فنعطيه هيبارين عشان يوقف الcoagulation لأنه أصلا بيستمر الوضع وياه ودم بيسوي له كذي. Body reduction ratio نسوي اليورين قياسنا difference لازم يكون هنا 70 وستية 70 من قبل وبعد. relative contraindication relative difficult vascular access needle failure heart failure with hypertension أن هذا إنه ما يصح يكون معه difficult vascular access needle failure heart failure with hypertension coagulopathy no absolute contraindication no vascular access. فلازم يصير له ذاك الثاني اللي هو peritoneal complication of hemodialysis catheter insertion may be rupture of vein hematoma يصير bleeding hemothorax pneumothorax vein thrombosis atrial puncture. فيسبب لنا rupture of vein. فيسوي لنا rupture of vein فيصير bleeding hemothorax pneumothorax في thrombosis atrial puncture. common complication during dialysis kg hypertension muscle cramps nausea and vomiting headache chest and back ache itching fever and chills. There's infection. الصراحة إنه المذاكرة دي اللي اخترتها بطريقة صراحة حلوة، إن حسيت إني كل شوي أشوف أفكار جديدة، يعني في خلال من ساعة 2 قاعدة أذاكر من ساعة 2 قاعدة أذاكر كل شوي أشوف أفكار حلوة جديدة. أحس عجبني. الحين نرجع نسوي نفس الدورة مرة أخرى من البداية عشان نخلص 4 محاضرات. دعوات أنا حدي 2 ساعة 5 أخلص إن شاء الله وأركز بعدين.